Hello and welcome to this edition of EC3 HOSA Medical Moments. We've been bringing you individuals who've been talking about the pandemic and what to do and some things, tips to help you with, and also common sense types of tools. Joining us today is Gary Ham, and he is the owner and CEO of ApotheCare Pharmacies in our area, and he also is a sponsor of this particular series that we have on HCEC-TV. What does the world of pharmacies look like today since the pandemic occurred?
Early on in this, we really didn't know what to do. It was kind of a changing narrative, and the information was different every day. So at first, I didn't know if maybe we were overreacting, underreacting. Then they started putting out some directives and some recommendations. And so our pharmacies have a front end, of course, and we were letting patients come in. Well, at first we tried the social distancing thing, and we did that for about a week. And at that point, the public just wasn't well educated yet. And so a lot of people weren't really following it. And of course, we had sick people coming in. People weren't wearing masks yet. And so we just decided, we had a meeting with our pharmacist, and I was kind of hesitant to close the front ends because I just didn't know how it would affect things. But we decided to close the front ends, and we went to strictly just drive-through or curbside service. And of course, we had the delivery service also. Okay. So at first I thought, maybe people will just go somewhere else, or they won't even come in the pharmacy. And we did have a little bit of that. People would come to the door and not know what to do, even though there was a sign there. But actually, in retrospect, people adapted to it pretty quickly. And I'd have to say, surprisingly, we had our busiest month ever in March.
Wow.
It was crazy. And April looks like it's going to be the same thing. Mm-hmm. Part of the reason was I think people were scared or panicking that they weren't going to be able to get their medications. Mm-hmm. And so early on, and now I'll just reassure people, our supply chain is fine. We haven't had any other than normal amount of drug shortages, and those only usually last a few days. Mm-hmm. So we just want to let people know that we will get them their medicines, and we do have their medicines. Fortunately, Governor Beshear passed a executive order allowing pharmacies to do emergency refills mm-hmm. and early refills. So what that did is, like, if people came to the drugstore and say they had 7 or 8 medicines, they could get them all at once.
Oh, good.
Yeah. And that's really what we wanted, because we didn't want people to make too many trips to the pharmacy, and we're trying to do all of our business through a drive-through, which
Now, can they purchase non-prescription items through the drive-through?
Oh, that's a very good question, yes. And that was one of the concerns was, will people know they can get stuff over the counter, and how will it affect that business, and will people think they have to do without? But no, they can just tell us what they need over the counter, mm-hmm. and we can get it for them. And some of the things people have been wanting, of course, have been Tylenol or ibuprofen for fever, cough medicines, and of course we'll talk about, masks, hand sanitizers, thermometers, pulse oximeters, gloves. Did I leave anything out? Toilet paper. For some reason, there was a run on toilet paper.
Hand
I think
sanitizers.
it's back in stock. Yeah.
It's been a crazy
time. Yes, we've been able to sell all that stuff through the.
Now, have your hours of operation changed?
We have not altered our hours. I thought at first we would probably just reduce our hours. Mm-hmm. But we have been so busy that we have not reduced our hours at all, and all the stores have stayed busy. and been able to accommodate everybody. So you can imagine, just generally, half our business people walk in and half would come to the drive-through, and now we're doing it all through the drive-through. But fortunately, we've been real efficient in just the timing of when people have come, and people really have been not having to wait. And if they have, everybody's been really patient and understanding. So it's worked out much better than I anticipated. I mean, we've had a few, glitches and stuff, but overall it's worked real well.
Now, with you being the owner of pharmacies, multiple pharmacies, did you get information prior about the illness, and when did you start seeing things coming through that, COVID-19 is something that's going to be happening quickly?
I'll have to say I got most of my information from the media and the television, and it seems like this has kind of been something that we've been playing catch up with.
Exactly.
And it's like, for example, as soon as we did social distancing, then the next thing they wanted us to close the front ends. Then we did that, and then they wanted us to wear masks and gloves, and so it's been a changing narrative, but we've adapted real quickly. Yeah.
Now, with your employees, have you been able to keep the majority in terms of helping out that way, or?
I thought there might be people that are employees in all businesses that would not want to work or whatever, but I'll just have to really compliment our employees. All of them have stepped up and worked extra when needed, been very helpful. I got a phone call yesterday from a customer that just wanted to thank how well an employee had done over in the Vine Grove area. And, we've had a few that have gotten, sick or had to take a day or two off, but we haven't had anybody test positive for COVID or any of our employees have stayed remarkably healthy.
That's great.
And so that just goes to show you, if you follow the guidelines, and you'll probably be okay.
Yeah. There's been some, let's just talk about immunizations.
Okay.
The discussion of if you've had the flu shot, if you've had the pneumonia shot, you should get both. Let's clear up some of those misconceptions.
Yeah, early on, I think that confused a lot of people because they were recommending if you hadn't had the flu shot or pneumonia shot, you needed to get it. And so that made a lot of people think, well, possibly that'll protect you against the COVID or the coronavirus. And that's simply not true. The reasoning for it was comorbidity. So they figured if you had COVID or you had the flu and then you caught COVID and then you caught pneumonia and you had multiple things going on, it would make you much more at risk for hospitalization and possibly even worse. So, and now that said, even with the front ends closed, they are allowing pharmacies to still give the flu shot and the pneumonia shot. And we have had a few people come in and do that. Now, as far as a vaccination for the coronavirus, for example, right now, we are ordering our flu shots for next year. That's how far advanced we have to.
Exactly.
And they're in the process of already making them. So the chance, I know they're talking about fast-tracking a coronavirus vaccine, but the people I talk to in the industry say, if we even have it, it'll be very limited because, they want to make sure it's safe and effective.
Exactly.
Because, that's been one of the concerns with vaccines. And if you put a vaccine out there that's not safe and effective, it just hurts all vaccinations. So I know they're working really hard on it. I hear they have one that's going to human testing already, but still, we'll just have to wait and see. I don't know. Yeah.
Well, you're probably more familiar with that. What is the process of doing those trials and those testing and some of the criteria?
Well, first,
with any medication.
Well, first, I'll tell you what I do know. I'm not in the manufacturing, but what I do know is with the coronavirus, the Chinese actually gave us the genetic sequence of it, which was a major help in the start. So once they had that to start with, then they could test and make a vaccine. From there, usually I think what they do from there is do some more testing, try to make sure it's effective and safe as possible, and then they go to human testing. And then in the human testing, they usually do a limited amount of people at first, and then more people, and see if it's safe, see if it works, and that just takes a lot of time. And then once all that's done, then they got to figure out how to make it on a mass scale.
Right.
And I think it was on the news, I don't think we have any vaccine factories left in America. It's sad. So then we're dependent on Europe or China to make it for us, which may not be a good position to be in. We may, wonder if there's a limited amount, who gets it, right?
There have been some misconceptions too about things just recently, and I don't know the name, but the drug that's used for malaria has been brought up a lot. There's it seems like you said every other day is something new, that it lives on this surface for a long period of time. It doesn't live here in terms of the virus components of it. What has made this one so different than the flu? And they always go back to, we lose thousands of people every year to the flu.
Yes.
I think it's the vast number of people that have died.
Yes.
From the time, 2 months? We were
So I'm like you. I can watch one news station and say, man, we've really overreacted to this. And then I'll watch another news station and I'll say, we haven't done enough. And I'm certainly no expert, but it's definitely changing every day. What I do know about this virus is I'm pretty sure it come out of Wuhan in China, out of a research laboratory that some people have said is a laboratory that makes it for warfare, germ warfare, so to speak. And then other people have said, well, it's just a research lab to find these viruses so we have a cure for them. So you really don't know what to believe there. But I think early on, it was just the fact we did not know what we were dealing with. They didn't know how virulent it was, how contagious it was. Early on they said it wasn't transmissible from animals to humans and human to human. There was just all kinds of stuff out there. But I think that was one of the things that made it so, so challenging.
It's like a moving target.
Yeah, it's definitely a moving target. And it seems like the more questions we answer, the more questions get brought up. I would say from what we know about the virus now is, as far as prevention is, it just gets back to the basics, just like with the flu. Hand washing, hand sanitizer, of course the social distancing, wearing gloves and masks, that type of thing, taking temperatures. Of course, another one of the unknowns is they say people can be asymptomatic and have it and not even know it. And when they're in that phase, most of the research has shown they can be communicable, give it to other people. So that has just made it real challenging. But hopefully we're on the downside. I think Kentucky has done a really good job overall of handling this. It's just been a challenge.
I was going to say, I think that I'm pleased and surprised that our numbers are so, even though we've lost a lot of people and a number of people tested positive, I think we've been blessed that it hasn't been the explosion, the hot spots that we've seen in New York and Baton Rouge and New Orleans and things like that. What about testing? Do you foresee that happening? I'm sure that people probably have said, do you have the test available? Can I test? What do you normally tell those customers?
Well, there again, the CDC and the national government and then our state government has allowed pharmacists to do the testing. with a CLIA waiver. Now, a CLIA waiver is basically a waiver that lets you do lab testing kind of on a fast track without doing all the accreditation. And we have that. The problem has been there's several different tests out there. Some of them have just been developed. I don't think Kentucky has gotten a lot of them because from what I hear still right now, you pretty much have to meet the criteria to get tests. I mean, I couldn't go into maybe Zip Clinic or Hart Memorial Hospital and say, hey, I just want to get a test to see if I have it. I don't think that's still available. Now, as far as for pharmacies, the challenge for our pharmacies would be, our front ends are closed. So how do we get someone in the store to give them the test? There's different types of tests. And who's going to pay for the test? Because the media has just told everybody it's going to be free. The only test we've been able to find in the pharmacy that I've been able to look at costs the pharmacy $100. Oh, wow. Now that's a lot of money, and we really don't have a way to bill it or anything. So I think if the government wants us to do testing, they will provide us with a good quality test that's reasonable, that will be covered, that we can do. Now, that said, I don't think we could do it in our pharmacies. I envision if we did it at our pharmacies, we would probably have to have a specially trained crew with the protective gear and maybe, like you see on TV, even a separate area or outside with a tent and the people wearing, all the protective gear. Right. Now, they did say one of the tests, the nasopharyngeal test, was real painful. Now, I know they've got a new nasal test. Then they've got, I think Abbott has a 5-minute test. And so there's a lot going on in that arena, too, that's really changing. And then once they came up with a 5-minute test, then they have to produce them and get them to people. So,
Right.
So I foresee in the near future, probably anybody that wants to be tested will be able to. But in the meantime, just the hand washing, and I'd like to clarify the hand washing and hand sanitizer. The CDC has it on their website, but hand washing is the best. I hear so many people say, well, I use hand sanitizer. Well, that's okay, but you should always wash your hands first and use hand sanitizer in between.
Gotcha.
So,
and really important there. Now let's talk about the shortages. Yes. I'm sure your facility, everyone thinks, oh, well, we can get masks, we can get gloves at the pharmacy. They have them there available. Yeah. Tell us about some of the shortages that you've seen and how fast did that occur?
Okay. Well, first I'm going to backtrack and answer your question about medications. I forgot that. So a couple of medications they've been using or in other states has been the Z-Pak or azithromycin and Plaquenil, which is hydrochloroquine. And we have plenty of Z-Paks for everyone. The Plaquenil, we've had enough to take care of our RA patients and
say RA?
Hydrochloroquine.
No, the RA, what does it stand for?
Yeah, it stands for rheumatoid arthritis and lupus. That's two conditions Plaquenil or hydroxychloroquine has been used for years. Okay. We've had enough supply of that to take care of those patients and not a lot extra. But we haven't seen a lot of it prescribed. And the data, I think, is not there. There again, you see one station, they've got someone on there that says it's curing everybody. Then you watch another station, they say it didn't help at all. So I think if you do the scientific method in the research, we really need to wait and see how that pans out. Now, as far as, I would agree with a lot of the experts, though, as far as I've had patients on this for years and years and years, 20, 30 years, I have not seen it to be a dangerous or a medicine with a lot of side effects. Okay. Now, there are some cases where people with heart arrhythmias, those type of medications can affect that, but it would be really rare. Now, getting next to the PPE, or that stands for protective equipment, there's been good supplies and bad supplies of that. Let's see, where would we start? Masks. Masks have been really hard to come by. We have enough for our staff. In fact, the health department was nice enough to give us some. Okay. a lot of this stuff sold out within a day or two, and we didn't save any for our staff. So, it just kind of caught us by surprise. I cannot believe at the onset of this how quickly stuff sold out.
Right.
I mean, we had cases of hand sanitizer, and it was gone in a day or two.
Oh, I know. Are people waiting at the door as soon as the truck pulled up?
I can kind of go through one thing at a time, I guess. The masks, we have enough for our staff and extra, but they're wanting us to reuse them. Mm-hmm. A lot of people, I think the hospitals and stuff have been a priority for them. A lot of people are making them. So there again, I think anybody right now that wants a mask can pretty much get them. And of course, there's been some controversy on masks too. Should you wear them, not wear them? If you fiddle with them a lot, you may give yourself the coronavirus. They don't really protect other people, but they keep you from giving it to other people. But yet the medical profession is using the K95 mask, which should protect you. And I think they are saying now, in some cities, they have to wear those masks out in public. Mm-hmm. So that's been one issue. I think the consensus is now if you're out in public and you have a mask, you probably should wear one.
Right.
The hand sanitizer, like I said, it went right away. Fortunately, we have some of the distilleries are making alcohol, and we have been able to get some of that and make hand sanitizer. Mm-hmm. Excuse me. And they're making hand sanitizer, and we're making hand sanitizer for sale. It's a little pricey because we've had to pay more for the ingredients, and we had to have plastic bottles, and we have to compound it, and we do have to use the FDA approved formula.
Oh, okay.
So we have a limited amount of hand sanitizer for our use and to sell for the public, but it runs out really quick as we make each batch. Thermometers. I've had a lot of requests for forehead thermometers. I can't find any, but we have been getting in a few every day of the other thermometers. So if anyone needs one, they could check at their store or call us, and we do get a few in, pretty frequently. Gloves we've been able to keep right now. Hopefully don't have a run on gloves at our stores, but we've been able to keep up with gloves. Let's see, what else were we?
That's probably the main things. The other things are those, the wipes. The
disinfectant wipes and Lysol.
Mm-hmm.
We had a promotion during the flu season, and we bought a whole end cap of it. Mm-hmm. I thought, I just don't know if we'll sell all of that. When this broke out, it sold all. There again, it was another thing that just flew off the shelves. Now, people can check with their retailers. We haven't got any in, but I know some of the dollar stores have been getting it in, mm-hmm. But not very much. And just check around, mm-hmm. If they need that. It surprises me in a way, just like the thermometers. I figured everybody had a thermometer in their house, but we have just had so many requests for thermometers. Pulse oximeters. Now, pulse oximeters, this is a weird thing about this disease, mm-hmm. is your pulse oximeters go on your finger and they measure the amount of oxygen in your blood. Okay. Your rate the oxygen rate in your blood is lowering, but people aren't having symptoms. Mm-hmm. So it can get down to 50%, and the only way you can do it is measure it. So that's why people are getting those. And just like when I came in here, you took my temperature. There's a lot of that going on, and just different things.
Mm-hmm. What do you think is the most important thing that people need to know?
I think the most important thing people need to know is obviously what we are doing is working. Just good common sense. So one thing I tell everybody, and this is just in general, get plenty of sleep, take your vitamins, keep yourself in good health, drink plenty of water, be on a schedule. Try to keep yourself healthy because that just helps your immunity. Mm-hmm. They were talking about alcohol use. Don't drink excessively, and just things in general that may affect your immunity. There again, just like with the flu, very lot of similar recommendations. Cough in your you know, your sleeve or cover your mouth when you cough, wash your hands, use hand sanitizer. Additionally, isolate yourself if you think you are sick. Be aware of those vulnerable groups. For some reason, it seems like children, there's been very few cases in children, unfortunately. I know there has been some deaths, and it's very unfortunate, but as a general rule, there's been very few cases in children, although they think they could be carriers. The elderly seem to be very susceptible, and they say 65 and older, which would put me in the high-risk group, but I feel like I'm very healthy. You know, if you're out in public, wear a mask, and for some reason, they are saying most all the cases are in people with comorbidity. And what I mean by that is, you know, they have some other health condition going on, like either COPD maybe or diabetes. Now, I'm not saying if you have those you're going to get it, but just be more careful. And most of the people have been elderly.
Right, and and I guess it's the idea too that their immune system has been compromised in some way. At that point, I
have heard one of the most, being in close contact with someone for like 20 to 30 minutes in a closed environment, it is not good as far as transmitting it. You know, we've all heard touching surfaces. So like at work, we've been wiping off counters and door handles and phones and keyboards and that type of thing, disinfecting stuff. That's the type of stuff that probably, just in a way, just good common sense and good hygiene. Right. You know, good health habits and good hygiene.
I was going to say, that's one of the things, the positive things that
that's going to come out of this, right? Right, yeah.
Yeah, we are going to be a little bit better at sanitizing things, hopefully. For those at home, where are the locations of ApotheCare located?
Well, we have 3 locations in Elizabethtown, one right by Hard Memorial Hospital, one on Woodland Drive at the E-Town Health Center, and then one at the corner of the corner of Ring Road and 62 was the old PNC Bank. And then in Vine Grove, we have one by the grocery store, Cash Cutters, I think it is, or Cash Savers. Cash Savers now. And in Radcliffe, we have one by Ollie's in the Radcliffe, I think it's Radcliffe Square Shopping Center.
Now, where are the drive-thrus located at those others?
Unfortunately, we don't have drive-thrus at Radcliffe and Vine Grove yet, and we've been doing curbside service, so people just pull up and stay in their car and call the store, and they bring their medicines out to them. All the E-Town locations have drive-thrus. Our newest store by the hospital has 2 drive-thrus, and so that has really helped there. But quite frankly, they've been able to keep up with the drive-thrus, and people, it surprised me how efficient people come through, and people aren't having to wait.
That's awesome. So they can also go to the website to find out information as well?
Yes, website. We have an app. We have, I think the best place for information is probably the CDC, and then I believe Kentucky has, the governor's made several directives, I guess, for healthcare workers and society, and he's done a lot. I think he's really been on top of it. Right. Fortunately for us, at first I thought, you know, I think we were the second state to close the schools and do a lot of things, and I'm like, wow. You know, I'm like, is this really necessary? That was early on, you know. It's like, man, I don't know, but in retrospect, it's been a good thing.
Best thing going on, yeah. Well, thank you, Gary, for coming in and for spending a few minutes with us and things. And we want to just remind people that ApotheCare Pharmacies are available, and they have drive-through service or curb service. So thank you again for coming in. Stay healthy and stay safe.
You too. Thanks for having me. And if anybody has any questions, they can call the stores, and we can, you know, give them the information or where to go.
Awesome. Yeah. And thank you for joining us at home for EC3 HOSA Medical Moments.